Okay, this video is about opioids. And the question is, are outpatient opioids long-term always bad? And, we don't know for all of them, but for the ones that are pretty well studied, like morphine and methadone, they're pretty much always bad long-term. Acutely, short-term, opioids can be very useful for relieving pain. It's pretty routine for, let's say, an imaging-guided surgery procedure to sedate the patient with fentanyl and Versed, fentanyl being the opioid. Okay, I made a previous lecture about opioids, how they can cause addiction and dementia. And this one, what I'm trying to say is I'm trying to show you this paper that shows that they don't work for long-term pain quite often, because while the acute pain response is mediated by the neurons, the chronic pain response gets glial involvement, like the microglia and astrocytes, and they basically counteract the pain blocking. So you end up with tolerance, meaning that you need a higher and higher dosage to get the same amount of pain relief. But the catch with a higher and higher dosage is you're then predisposed to more side effects, respiratory depression, respiratory failure, and death. I personally know two healthcare workers that had a family member die from opioids. It's actually quite common. Tons and tons of people die from opioids. My advice is to never take them if you can avoid it. They're often used in end-stage cancer patients in hospice and whatnot, but I'm just saying is if you can avoid it, avoid opioids. They're much, 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 much worse in the long-term setting than is widely recognized. Chronic opioid ingestion, well known for morphine and methadone, they activate microglia and astrocytes, which cause increased neuronal excitability and downregulate GABA, the blocker. So what they do is they cause more pain. So they're counteracting each other. The opioid effect on the neurons to relieve pain versus the opioid effect on the glial cells to increase pain. I'll just show you an illustration from this article. So this is just showing normal pain, like this person here steps on a nail. It's transmitted through what are called C fibers and A delta fibers. They go to the dorsal horn of the spinal cord, and then the pain transmitting neurons pass up to the brain. Once they get up to the brain, they usually should only be activating the neuron, and they're going to activate something called an NK1 receptor and an AMPA receptor. Usually the NMDA receptor stays closed with the magnesium in the center of it. When the pain is facilitated, a more classical view is that you'll now get activation and opening of the NMDA receptors. But here's the point. When you have chronic pain and chronic opioids, you start activating your glial cell. Like here's an activated microglial cell. And these then will start releasing inflammatory chemicals, and they'll increase the pain response. They'll amplify the pain. So you're screwed. What I'm basically saying is the longer you stay on it, the more likely you're screwed, and it's going to be counterproductive. So, this was an interesting article. It was recommended to me by some pain experts. And I just thought it was interesting that, you're not going to win that game. And my advice is don't even play that game because the consequences are quite dangerous. Tons of people die from opioid overdoses. So anyways.